This is the injury report presented by NYU Langone Health. The Yankees are headed to the postseason, but were dealt a blow when pitcher Nestor Cortes landed on the 15-day IL. The team is saying he's dealing with a left elbow flexor strain. So let's bring in Dr. Michael Alaia of NYU Langone Health to get some answers on when Cortes may be back. Doctor, thank you so much for joining us. How are you doing today?
Awesome. Pleasure to be here.
Good. Thanks for joining us once again. So real quick, can you explain what's going on with Nestor Cortes and how does this kind of elbow injury happen in the first place?
So the first thing I think it's important to understand is that we're only given a limited amount of information. We're not the team physicians for the Yankees, but at least from what you see, what's been written so far, it seems like it's something called a flexor strain of his elbow, or taking into consideration what pitchers do, you would think it's a flexor pronator strain inside the elbow. So on the medial side of the elbow, or on the inside aspect of the elbow, there are important structures. Number one, the Tommy John ligament or the ulnar collateral ligament lives right there. And that's important for stabilizing the elbow when they cock up, when they wind up, when they early accelerate to pitch in their games. And then you've got a muscle mass over there called the flexor pronator mass. So essentially there's a tendon that attaches right onto the medial side of the elbow, right over here, which is very important when pitchers are winding up and then when they start their early acceleration in the pitching phase. So that tendon, or that muscle tendon unit, can become very inflamed. It can become strained. Sometimes it could tear. Now, it doesn't appear that there's a tear here or a major injury because he's only on a 15-day IR. So hopefully this is just a strain of his tendon.
Okay, so like you said, hopefully it is that strain, something not too bad. So 15-day IL, what do you think is the best case scenario for when he could return from that?
Now, I think 15 days is pretty optimistic. We would all hope, because it's this playoff push at this point. Obviously, everybody wants to get him back onto the mound as soon and as safely as possible. But it's very common that you could see these injuries linger for about 2 to 6 weeks. So 2 weeks might be an early estimate. If you're looking more in terms of law of averages, we might be thinking more about 4 weeks, hopefully not 6 weeks, because everybody would like to see him back on the mound.
Yeah, absolutely. He's been a huge part of this team, from starting pitching and also in relief. So you're talking about that time frame. Would you say 6 weeks is kind of that worst case scenario? Could something else happen beyond that?
Most likely not, if the injury is truly what it's set out to be and the reports are accurate. I think 6 weeks would be a little longer than I would hope for. 4 weeks, probably more typical, average time. But you never know. I mean, he's a professional athlete. He's going to get the best care, the best physical therapy and rehabilitation. So 2 weeks is certainly a possibility. That's the best we can hope for.
Yeah, absolutely. And you mentioned this because it's a little bit of a different time frame because of this postseason. Do you think doctors are looking at things any differently since there might be a pressure to get him back as soon as possible?
Yeah, I don't know if they're going to look at things differently. I mean, physicians are supposed to do what's best for the patient at all times. So they're going to give him the rundown of what's going on. They're going to talk to the trainers. They're going to talk to the coaches and the staff on the Yankees, and they're going to make the best decisions possible. Obviously, we know it's a playoff push, and we want to get him back out there and pitch. But obviously, we also don't want to jeopardize his elbow health for the rest of the year or years to come, because if something does happen on the medial side of the elbow, then obviously we don't want to see that. But ultimately, it's our job to make sure the patient is well cared for, the athlete is well cared for. I'm assuming that they're going to do all of that very nicely and hopefully get him out there. Yeah,
we hope so, and hoping it is more on that two-week side of things as opposed to 6 weeks. But doctor, thank you so much for joining us. Really appreciate your time this afternoon.
You're very welcome. Thanks for having me.